Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're going to be here now in the fall each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For a question during today's forum, which is update number 64, please email plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Now today our participants include Kenneth Tavares, he is the chair of the Plymouth Select Board. Sarah Cloud, she is the Director of Behavioral Health and Social Work at Beth Israel Deaconess here in Plymouth. Dr. Mark Wilson, he's the active professor emeritus, University of Michigan, School of Public Health, Department of Epidemiology. Karen Keane is the Director of Public Health for the town of Plymouth. Erik Cioffi is the Assistant Superintendent of Plymouth Public Schools, Assistant Superintendent for Human Resources. Also Michelle Bratti, she is the Director of Elder Affairs for the town of Plymouth, the Center for Active Living. Amy Naples, Executive Director, Plymouth Area Chamber of Commerce, and Matthew Muratore, our Plymouth State Representative. And as we do each week, we're going to begin by welcoming the Chair of the Plymouth Select Board, Kenneth Tavares. Kenneth, good day.
Good day, Steve. It's good to be here. I would like to start out this afternoon with some information that I think is going to be very important in the following weeks, and that's talking about elections. I know we just finished with one, and we're preparing for the November 3rd. I had a very good conversation with our new town clerk last week, and I wanted to pass on some of the information that she has, because dates are very, very important to make sure that we're all complying with the law. And the first is the deadline to register to vote for the November 3rd general election is October 24th at 8 p.m. Ballots for the November general election should be arriving at Town Hall during the first week of October and will be sent out as quickly as possible. The printing is done by the Commonwealth and the Secretary of State's office, so we need to get those ballots first, of course. And if you have not applied for a ballot by mail for November, the Elections Division will be sending out postage-paid applications by September 14th. You can track your ballot status on the Election Division website, and it will show you whether your ballot has been mailed or not. This website is wonderful to have. I know many of us used it in the last election. It's up to date, and it gives you the information that you need to make sure that you have a ballot properly brought back for counting. Ballots must be returned to the town's clerk's office by 8 p.m. on November 3rd, postmarked by November 3rd and received by November 6th. Your ballot for this election will be two-sided, and please remember to sign your ballot envelope and place your ballot in that envelope. Also, once again, in person, early voting will be offered at Town Hall in the Great Hall meeting room from October 17th through October 30th. And you can turn to the town clerk's website for the hours. I know that we went through those dates quickly. We will be repeating them in future broadcasts, but it's something that you need to start thinking about as to how you want to cast your ballot in this very, very important November election. Thank you, Steve.
Thank you, and that's Kenneth Tavares. He is the chair of the Select Board for the town of Plymouth. And we now welcome back Sarah Cloud. She is the Director of Behavioral Health and Social Work. Good afternoon, Sarah.
Good afternoon. Thank you for having me back. Last time I think I was on the show was last spring, and we talked about making the most of graduation and celebrating milestones. So here we are, still living in the world of COVID.
Okay.
So I'm back again to talk about transitioning back to school in the setting of shifting and ever-evolving information, which leads to a tremendous amount of uncertainty. So in this setting, it's to be expected that parents, teachers, other school personnel, and children are going to be nervous about our given state, our current state. So while levels of anxiety and stress may be high, parents and teachers play a really influential role in helping children cope and encouraging a positive back to school transition and helping to reduce children's anxieties and worries. So fortunately, children are both very resilient, but they're also very perceptive. So children really take their cues from adults, the adults that are around them. So I'm not suggesting that we as adults should pretend that everything's okay when it simply is not. Um, we don't always have to feel calm and in control. What I'm trying to impress upon us is that it's important to model good coping skills, self-care, and the development and adherence to a routine to help our children through this process. I'd also recommend having honest, factual, and open conversations with your child. You've been practicing good hygiene, wearing face masks, and physically distancing all summer. So these honest discussions about COVID and the implications for returning to school will build upon all that work you've already been doing with your child. Another strategy that can be helpful is what is referred to as name it to tame it. So what that means is that parents or teachers can help their child identify their concerns by asking them what they're worried about. Then we can help the child name the worry or concern by labeling it. So for example, a younger child might name their fear as the worry monster, or an older child may simply label the emotion as anxiety, and that can be really helpful to name the worry. So it helps tame the fear by helping children build understanding about what they're feeling. It also gives adults and children a common language around emotion that can be used for future discussions. And it helps provide opportunity for adults, provide emotional support and coping strategies. And lastly, children often want reassurance that their fears won't come true. It's tempting for us as adults to say everything's going to be okay or no one will get sick, especially when we're struggling with our own anxiety and our own exhaustion. But such words can prevent children from facing their fears and developing problem solving and coping skills to address it. They can also prevent children from taking precautions to mitigate COVID-19, such as physical distancing, as they may perceive the risk to be low or non-existent. So instead, try to acknowledge and support your child in the discomfort that there are some things that may be out of our control, and that it's best to focus on what we can control. Thank you.
Thank you. That's Sarah Cloud. She's with Beth Israel Deaconess. Good words to remember as we continue to respond to COVID-19 with the opening of schools and paying attention to the needs of our young people. And at this time, we're going to continue with our health segment and welcome back Dr. Mark Wilson. He is a Plymouth resident and an epidemiologist. Welcome, Mark.
Thank you, Steve. It's great to be back. I was just reflecting, it's been 2.5 months since I was last part of the program, and that was on the 25th of June, I believe. And in thinking back about the time since then, I think we all know that unlike many other states that have experienced huge spikes in new COVID cases, Massachusetts has remained roughly stable during this time. And this is also true for Plymouth, of course. And I think it's evident that our fellow citizens are following recommendations for preventing transmission, but we only have to look around to other places in the US and in the world to know that this pandemic is still very much with us and will quickly return to our doorsteps if we let down our guard. So I continue to be pleased to see that most people are walking around town wearing a mask when they are near others. Masks and other well-known simple prevention measures continue to prove effective, and it will be necessary to practice this prevention for many months to come. This leads to some questions that I wanted to give brief answers to, and the first one is the following. Can you briefly explain why it is taking so long to develop a vaccine? Also, is there any hope that I could be vaccinated by the beginning of 2021? let's step back and remember what's involved here. First, you have to find a candidate vaccine. And that began last January, really, very shortly after the virus was first identified. Then you must go through 3 phases of clinical trials. Phase 1 clinical trials are these small scale trials that assess whether the vaccine is safe in humans and how much of an immune response it evokes. Phase 2 clinical trials are a little bit larger, a few hundred people. They assess the vaccine efficacy, also their safety, side effects, immune responses, and so forth. And there are many COVID vaccines that have gone through now phase 2. Many others are in the process as well. But phase 3 is what we're really concerned about now. And it is a very necessary, large scale, involving thousands of participants, trial that usually involves many sites, which is aimed at evaluating the efficacy under natural conditions of disease risk. So if the vaccine remains safe and effective at the end of phase 3 trials, then the manufacturers can apply to the regulatory authorities for a license to market the product for human use. Most people know that phase 3 clinical trials are now underway for a few promising candidates. But these are really very complicated epidemiologic studies that are typically called randomized, double-blinded, placebo-controlled trials. Placebo-controlled basically means that a group of volunteers, usually roughly half of the volunteers, receives an injection of the vaccine being tested, while the other half receives an injection of a harmless saline solution, for example, which is what we call the placebo, that contains no vaccine. And these 2 injections basically look alike so that volunteers don't know whether they received the actual vaccine or the placebo. The term randomized means that volunteers are assigned to the research by the researchers at random to one of the 2 treatments, either the placebo or the vaccine itself. The double-blinded part of that long term refers to the fact that neither the volunteer participants nor the scientists giving the injection and recording health data know whether or not the participants received the vaccine or the placebo. And there's a secret code for each participant's injection, and only the statisticians and project directors have access to this. So the scientists won't know who received what until the code is uncovered and the analysis is begun once enough people have been vaccinated and enough time has passed. So this helps to keep certain kinds of biases from influencing the results and helps preserve the objectivity of the science. This takes a long time, and this is part of what we're faced with right now, is that frustration that we're in such dire need of a vaccine, and yet we have to go through these processes which are so critical to safety, efficacy, and lack of bias. One challenge is that there are diverse characteristics of the volunteer population. For example, their age, their gender, their race, their socioeconomic status, and so forth, that have to be considered, and they have to be similar to those of the characteristics of the population that the vaccine is intended to help. For COVID, of course, that's all of us, that's everyone. Therefore, the vaccine trials need to be inclusive of volunteers from groups can take longer if not enough people from various groups volunteer to participate. And this is another problem that's being faced right now by those candidate vaccines in phase 3 trials. Another reason that it takes time is that the researchers must wait until enough people are naturally exposed to the virus. So ethically, it's not really possible to test a vaccine by intentionally infecting people and then waiting to see who becomes ill. So the only way to determine effectiveness is to wait and see whether naturally exposed people who are injected with the vaccine develop disease less than the placebo injected people naturally develop disease. And this can take months or even years, but that depends on how rapidly new cases occur. For COVID, the current estimates suggest that new infections occur frequently enough and have will produce enough statistical power for us to give an answer to this in a few months to at most a year or so, depending on the specific vaccine and trial. Even though it seems like it's taking ages for this process, in fact, the speed with which COVID vaccine candidates are being developed and are now being tested is really unprecedented in human history. Most vaccines will take years, even decades to develop and market. The urgency of the COVID pandemic has stimulated really extraordinary scientific efforts. And there are now multiple vaccines being tested, as I mentioned before, as everyone knows, in many countries throughout the world. And so it's likely that many vaccines will eventually be approved, but some may still take years. The key, however, is to be sure that the vaccine does no harm, despite the urgency of vaccinating billions of people globally, and as soon as feasible, of course, but we can't speed up the process. In the meantime, all of this suggests that we need to continue practicing behaviors that reduce transmission and adapt our reopening efforts to minimize risk and reduce exposure. We need to follow what the science has shown leads to and can reduce transmission, and wait for the science to provide us with safe and effective vaccine options. So let me just address another question that is related to this in a way. And it is, why have 9 major pharmaceutical companies involved in COVID virus vaccine development announced that they will not file for FDA review until clinical trials have fully demonstrated safety and efficacy? Is this normal? And is it naturally how it works? Well, first of all, no, this is really unusual. And indeed, I believe it may be a first. The United States FDA and similar regulatory bodies in many other countries have strict laws for the approval and legal use of pharmaceuticals, including vaccines. And they require extensive evidence of safety and efficacy that include these phase 3 trials that I just discussed. However, President Trump's politicization of the vaccine has created fear among people that having a vaccine before the November election will lead to safety shortcuts. Therefore, these pharmaceutical companies, and there are 9 of the major companies involved here, have jointly promised that they will not ask the FDA for earlier special consideration for their vaccines. And the goal of this is to reduce fear and to bolster public confidence that the vaccine safety will be respected, and that once one or more vaccines is widely available, that people should not have fear that the COVID vaccine will be harmful. And so the hope then is that the vast majority of people will want to be vaccinated and will not resist due to unfounded worries or distrust of the public safety process. So from a public health perspective, vaccines are considered to be the single most important tool in combating infectious diseases. And currently there are more than 25 infectious diseases for which vaccines are regularly used in the United States and throughout the world. In addition, there are many others to which people have taken for special purposes, for special occupational reasons and so forth. And so despite the fears that vaccines have caused autism and some other conditions, there's really enormous evidence that they're safe and effective, and only in rare occasions have they produced any negative side effects. So if people fear that strict regulatory testing is cut short because of political or economic reasons, many people may refuse to take the COVID vaccines, which would unfortunately allow the current pandemic to continue. And this is really why this unprecedented move by the pharmaceutical companies has been undertaken, is to assure the safety and efficacy is as intended, and to give people confidence that they will not be harmed, will be protected, and eventually, hopefully, will be vaccinated. So I will stop at this point, and we'll be happy to answer questions from viewers later on in the session.
Thank you, Dr. Mark Wilson. And viewers can send questions to PlymouthInfo@pactv.org. And as we continue with our health segment, I would share with everyone this morning I was in a pharmacy and I was approached by a Plymouth resident who thanked me for this presentation. So thanks to all the panelists, thanks to all of you who are watching. We're now going to go to Karen Keane. She is the Director of Public Health for the town of Plymouth. Welcome, Karen.
Thanks, Steve. So today I want to go over a couple of items in relationship to COVID-19 here in Plymouth. Quickly, I will give you the numbers. We have 660 confirmed cases since the beginning here in Plymouth, of which have resulted in 76 deaths. Our numbers at the beginning of the coronavirus were mostly folks in an elderly population in long-term care facilities and congregate settings, but it has shifted. And now we're seeing more and more people in their 30s and younger, including teenagers. We have not seen any children yet, but we are seeing younger people. With that has come a new situation which we did not have to address until recently. And that is people not being willing to discuss their contacts with contact tracing. So I want to talk a little bit about contact tracing and why it's so important. Contact tracing means that if you are tested positive for coronavirus, you are what's referred to as a case. And then either myself through the Department of Public Health or the state of Massachusetts through the Contact Tracing Collaborative, CTC, will then reach out to you to ask you who are your close contacts. Who are the people that you have been with closer than 6 feet for more than 15 minutes? Now, I know that some people have addressed concerns about privacy and scams, and I want to make sure that everyone understands that if the Mass COVID team calls you, they will use the prefix 833 or 857, and the caller ID will say Mass COVID team. They will never ask you for your social security number, nor will they ever ask you for a credit card. There have been a couple of cases where people have called, scammers have called and said, just in case you need a test, we'll need to take a credit card number first, so we're all ready to go with that test when we're done answering these questions. You'll never be asked for your social security number, and you'll never be asked for any type of payment. Calls are made daily from 8 a.m. to 8 p.m. The Department of Public Health's phone number will come at this 508-747-1620. The case's identity and the contact's identity are protected. The contact tracing team will reach out to those close contacts and gather the information, but they will not exchange information on why they are calling, who the case is that they're calling about, nor will they share any additional contacts with other contacts. So your information stays with the person who's gathering the information from you. So why is this important? Why is it important to pick up the phone and to talk to these people who are trying to gather this information? It's important to track the spread so we can reduce additional exposure. It's to encourage others to go to testing, to support the quarantine and also social distancing. Also something to think about too when we reach out to people who are contacts, they may need services, and we're here to offer those services that might be necessary. Because if you're a close contact of a case, you'll be asked to quarantine for 14 days. So you may be concerned about, how am I going to get my food? I need prescriptions. What's going to happen to these other deliveries that I'm waiting for? I need social services. Those are all things that can be helped along with the contact tracing, either through the CTC or through my department. So that's why it's really important to pick up the phone when the contact tracing teams call you. The other thing I want to talk about today were complaints. People ask, what do you do when you get a complaint, and how are you getting complaints about people who may not be following workplace safety standards, mask protocol, other policies and procedures? So I wanted to go over that. Complaints are received in this office of the Department of Public Health. They can be either emailed to us or that someone could call in. They could also come in through the state, either through the Department of Labor Standards or through the governor's office or through the website at mass.gov. A complaint form is then completed by a member of this office, the Department of Public Health. The complaint will be investigated within 72 hours. The complaint form is completed, and then there'll be an outcome. So ideally what the outcome is we go out there and we find out that it's just a matter of education. Maybe the owner or the manager of the store or the food establishment just needed a little touch up on education. They were unclear on some things. And once we were out there and we were able to educate them, then they were compliant. If there is a second offense, they're given a warning. The outcome is shared with the complainant, the person who did the initial complaining. We will follow up with them to let them know what we found and what we've done. And then the complaint form is filed here in this department in the establishments folder. Currently, here in Plymouth, we have received 32 complaints. 6 were for non-food businesses and 26 were for food establishments. The majority of those were for mask violations, whether it be staff members weren't wearing a mask, food servers weren't wearing a mask properly. So then we educate, we leave additional materials if necessary, we'll put up posters, additional signage, and then we also keep the Massachusetts Department of Labor and Standards updated as to what the complaint is and what its resolution has become. Also, I want to talk a little bit about testing. Currently, there's still one location that we're aware of, and that's Convenient MD in Pembroke at exit 12, that will test a person who is both asymptomatic, meaning they have no symptoms, and they do not have a referral from the doctor, meaning I just want to be tested for whatever reason that may be. I want to have a COVID-19 test done. Convenient MD, Pembroke, exit 12 is the location that we're aware of. There are also locations through the governor's office for the Stop the Spread centers, and they, Brockton and Randolph, I believe, are the 2 closest that have been held to Plymouth. When those dates come up, they're open to anyone who lives in the state of Massachusetts, and we post those dates on our website. The website is www.plymouth-ma.gov. And under departments, you'll go to Department of Public Health and you'll find the information there. And again, I would just finish up with, I still want to congratulate our residents and our visitors. This has been a very difficult time. Also our businesses and our business owners. I think that we're all working together quite well to combat this virus. And I will remind you of the big 3. Continue to social distance, wear your mask, wash your hands, and if you cannot wash your hands, have your antibacterial sanitizer close by. And that's it. Thank you.
Public health for the town of Plymouth. And as we move from our health segment to our educational segment, we're delighted to have today a new panelist who has just joined Plymouth Public Schools, coming from Georgia. It is Erik Cioffi. He is the Assistant Superintendent for Human Resources. Erik, welcome, and any change from coming from Georgia to Plymouth?
Well, first of all, thank you for having me on here. Well, Dr. Wilson already pointed out that there are places across the country that are spiking. Georgia was certainly one of those states. But there were certain safety measures that were not in place here. So as Karen was talking about the culture and seeing people about contact tracing, those are things that we struggled with in Georgia. And since I have come here, I have been so pleased and with the safety mindedness that our district leadership has had, our principals in the buildings. There's been a lot of focus these last, well, since March 13th, when everything changed in education. There is excitement. Sarah talked a little bit about the coping mechanisms for our students and the fears and the anxieties, and we get that. She was spot on. Our staff wants to get back to see these kids. Our teachers have some of those same fears and anxieties. There's also excitement. Educators, we got into this business to help shape and mold students. And a lot of our students we haven't had access to for 6 months. And so being able to provide different platforms for our students in Plymouth, we do have 450, 460 students that have elected to do the remote learning option. So that classroom is going to be looking differently than what a traditional classroom looks like. We are using the hybrid model. So that is going to be certainly different than it has been in the past. We went out, I've been into the schools. I came from a state where there were no mask mandates. Social distancing was not an expectation in schools. I had close to 800 students that came daily, and we had to space them as best we can. My focus was to keep our students and staff as safe as possible. When I look at the plans that are in place here, following CDC guidelines and following DESE, 6-foot spacing is available. So that's going to go back to what Karen was talking about with the contact tracing, whether it's a home exposure or school exposure. We have that 6 feet, in a lot of cases more than 6 feet, following the 15-minute guideline. I've encouraged the staff that I've had an opportunity to meet in a short window of time. There's nothing wrong with limiting yourself to 10 minutes worth of contact, because our goal is to keep our teachers coming every day, our students coming every day. They've been practicing these safety measures all summer long. It's evident when I walk around, and I'm starting to get acclimated to the community. That is the culture here. That's going to be no different at school. I think once the 16th hits, we get our students back in the classroom. I think we can get back to doing what we do, which is educate our students and be able to build those relationships and provide that additional support for the families and students that need it. So there's a lot of moving parts. I can tell you that our custodians, our groundkeepers, our skilled craftsmen, our nutrition workers, our secretaries, parapros, the list goes on and on, our nutrition staff that have worked so hard in preparation for bringing students back, getting the PPEs available to our staff and to our schools, and keep that learning environment moving forward. That's our goal. That's what we're charged with. We know that there's anxieties out there and fears from not only our students, our staff, our parents. I believe once we get everybody in the building and we see things and see how they're operating, I believe really good things are going to happen for us. Your body can't go where your mind hasn't gone. And, we've had a lot of conversations. We've had a lot of thoughts. We've kind of dissected the process. I've been in conversations since this summer, even though I didn't start till last week. So I see a lot of the things coming together. One thing about education, we'll identify real quick if something's not working, we need to change it. If it's a flow pattern, travel pattern. But I believe that we have the instructional staff, the administrative support to make this transition back to school successful. We've got to remind our students about the distancing, the timing, wearing your mask, keeping our hands clean. I'm hearing all the panel discuss those things, and as a school, we're kind of in the middle of it, right? Or we're going to be in the middle of it, and that's our number one focus, is keep our students and staff and anybody who comes into contact with the school safe. One of the biggest excitements I've had since I've been here was when I watched kindergarten screening taking place across the street from the central office. It looked different. I think it's probably the first time that they've ever done a screening outdoors, but it occurred. It's happening. So that gives us some excitement. And of course, to be able to see the students back in school, I think As Sarah will attest, the relationship with the schools is critical for supporting our students, and that's something that we look forward to doing. So I'm excited to be here. I bring some experience from the state. We actually opened schools back in August. So I was able to kind of see that process and to be able to come here and see what's in place. I'm excited for the 16th, and I look forward to working with the community at large.
Erik Cioffi, he is the new Plymouth Public Schools Assistant Superintendent of Human Resources. He'll be continuing to stay with us and answer your questions by sending them to PlymouthInfo@pactv.org. And once again, we welcome back Michelle Bratti. She's the Director of Elder Affairs for the town of Plymouth. Welcome, Michelle.
Hi, Steve. Thank you. And PAC-TV once again for having me as a guest alongside this esteemed panel. And Erik, welcome to Plymouth. We're glad to have you. Next week is going to be a super busy one for the Center for Active Living. On September 14th, CAL will officially open for limited programming utilizing our multi-purpose dining room area. And we couldn't be more excited to see some beautiful. We will be holding one program per day. And even though our dining room is part of our large area, we will not be serving lunch at this time, but we'll continue our grab and go program. Registration will be mandatory and no walk-ins will be allowed. There will be strict guidelines for social distancing, a checkpoint entry for temperature taking and COVID-related questions, and safety protocols will be strictly enforced. Stay tuned this week to our Facebook page, the town website, our constant contact, and other media outlets for details about these new policies, registration for programs being offered, and what CAL will physically look like during this phase of our opening. We may have a little surprise on how that looks, so stay tuned. September 15th is Senior Appreciation Day in Plymouth. It will be a day to celebrate and acknowledge seniors in the town of Plymouth, particularly during this pandemic. In partnership with Beth Israel Deaconess Hospital, the Philharmonic, and the Chamber of Commerce, our goal is to honor, acknowledge, and appreciate this robust population in our community. Almost 22,000 strong if the 2020 census remains accurate. There will be a 3-route honor parade starting at the Center for Active Living from 1 to 1:45 p.m., on to Beth Israel Deaconess from 1:30 to 2:15, and ending at the Chamber of Commerce from 2 to 2:45. At each parade site, seniors will be met with fanfare and celebration and be given gifts and tokens of appreciations to show our gratitude for their strength and resiliency during this time. There will be a raffle ticket given to each participant for a chance to win a prize donated from, of course, a local area business who are always so supportive of our seniors. One of the notable events kicking off this day and concluding on September 17th is Operation Senior Serenade. Our beloved Philharmonic Brass Quintet will be serenading seniors live and in person at several of our senior housing complexes. And to ensure that each and every resident in their apartment can not only hear the music, but see them as well, the musicians will be moving their location every 15 minutes. We welcome, our select board has proclaimed to honor September 15th as Senior Appreciation Day in the town of Plymouth. We are so excited and honored that they've agreed to do so last evening. And their show of support is just unparalleled in this town. Local area businesses will, as I mentioned, be graciously donating raffle items and giving discounts to seniors in honor of this special event. Listen, this population is most at risk for coronavirus. And as a result, our elders are the most socially isolated during this time. There is a stereotype that already exists regarding senior vitality and engagement. And sadly, COVID has reinforced this notion in that they are now the proverbial population that are somehow just dying in nursing homes from coronavirus. I contacted PAC-TV when the pandemic began and wanted to create a documentary focused on social isolation during this pandemic and how seniors would cope with all that it brings. The focus is not on the frailties of this population during the pandemic, but rather their strengths, resiliencies, and coping strategies born out of rich life experiences, coping strategies that honestly we all could learn from. This day, Senior Appreciation Day, is about acknowledging their significance in our community in this respect and to let them know their voices, strengths, and concerns are noticed. To let them know that not only are they visible and heard, but they're respected by this community. We can't wait to see their faces in their car, of course, and socially distanced, but we very much looking forward to honor our seniors on this day. Thank you, Steve.
Thank you, Michelle Bratti, Director of Elder Affairs, Town of Plymouth Center for Active Living. And we now go to Amy Naples. She is with the Plymouth Area Chamber of Commerce. She's the Executive Director. Amy, we started this about 6 months ago. What's changed with businesses?
So much has certainly changed, but yet so much hasn't, right? We've opened, we've closed, we've gone through a lot, but today I want to talk about consumer spending. Our local economy is the tapestry woven by our dedicated hard work of our small business owners and their employees. Now the collective economy is facing a challenge like no other, and we need to keep rock solid and help our small businesses through this challenging time because it truly takes a village. Think of places that make your community feel like home. Chances are there are local shops, restaurants that come to mind. And sadly, the truth is many of those businesses are hurting right now. They're still, however, standing strong and doing their best to continue operations, greet and service with a smile, and keep us safe while doing so. Our small businesses need our love. I cannot emphasize enough the impact that shopping local has on our economy and the need for all of us to be doing so. It seems easy that with a few clicks, you can go online and order something and a package arrives on your doorstep the next day. But we really need to change those consumer habits and support our local businesses. Many of our local shops and restaurants have websites, and you can do the same thing as click away, online ordering. They make it so easy, and they offer curbside pickups and delivery. So be sure to kind of think about supporting local before you go to the big box and larger corporate websites. The summer months have been helping our businesses stay afloat, definitely, but we know we have some major hurdles ahead of us with the winter months. So alongside my partners with the members of the Plymouth Recovery Task Force, we're working hard on recovery efforts, however that may be, in so many different ways. So we're trying to offer opportunities for businesses, creative marketing opportunities. We do know that we have to be competitive and give consumers a reason to support our businesses and spend their hard-earned money, certainly. So we're coming up with creative opportunities for us to do so and offer those. We're determined to do so because we need to keep businesses open, our community employed, and certainly our shopping and dining and downtown waterfront districts vibrant. Which leads me to another great topic I want to talk about is our Chamber of Commerce is hosting a waterfront pop-up on September 18th and 19th at Nelson Park. The waterfront pop-up is an artisan marketplace for local artists to sell their goods. It will be very similar to a farmer's market, however, be touchless, socially distanced, and have an array of great items from talented artists from all over this area. Certainly an industry that has been impacted is our local artists. Our marketplace will be adhering to all the governor's guidelines for marketplaces, and we've added additional measures to ensure the safety of participants and attendees, limiting the amount of people, the amount of participants. Masks, of course, are required. We will also be doing contact tracing. There'll be sanitation stations throughout the park. There'll be times that you can register to come into the pop-up versus having to wait. So we've kind of come up with some creative ideas to make this a very, very safe event for our community. So it will take place on Friday, September 18th from 3 to 7 p.m. and on Saturday, September 19th from 9 a.m. to 2 p.m. We're also kicking off the weekend or pop-up with an event for a cruise night car show at 180 Water Street, which is Water Lot 4, next to Hotel 1620. This will be a socially distant event and something for the whole family to enjoy. And certainly we are doing so to kind of stimulate our economy, encourage folks to visit the pop-up and cruise show, as well as patronizing our local businesses. Also, last week, I mentioned on the show that the Chamber has been a strong advocate for the mask mandate, and I'd be dismissed for not plugging that again this week. So please, please wear a mask. Not only does this protect you and others, but this is also protecting the health of our community and our local economy. The Chamber is very serious about this. We have been working around the clock at coming up with ideas to enforce this, to ensure the safety. All businesses do have masks that they are willing to hand out to anybody that does not have one. In addition, myself, Bob Nolet from my team, and Jerry Levine from the Board of Health will be installing all of the mandatory mask signs around town on Friday. We have 200 that will be installed. So we're excited to continue our efforts to make America's hometown safe. And lastly, the Chamber has so many great activities planned, webinars, opportunities for networking for the fall and winter as we're kind of gearing up. And you can find all of our offerings and programming at plymouthchamber.com. And that is my update for today, Steve.
That is Amy Naples. She is the Executive Director, Plymouth Area Chamber of Commerce. We now go to Matthew Muratore. He is a Plymouth State Representative. Matt, we started this 6 months ago. We've come a long way in the beginning trying to figure out where we're going to go. We've got lots of people working to make everything respond well in Plymouth. Matt.
Yeah, good afternoon, Steve. Good afternoon, everyone. And yes, welcome, Erik, to the Plymouth community. We look forward to working with you. Very pleased that you are here. Yeah, we've come a long way in 6 months. To date, since February 1st, actually, there's been 1,876,973 individuals who have been tested here in the Commonwealth. And there are 6,900,000 people that live here. So you can kind of do the percentage of the math of how many people have been tested, and it's all about testing and tracing. And I think that's one of the reasons we've done so well. The total confirmed cases through yesterday is 121,214, which is a 7-day average positive test rate of 0.9%, which is the lowest that we've been running for a 7-day average. The amount of deaths are 8,933. And although we had 8 deaths yesterday, that's a new low. So we're finally seeing that trend going down. And the hospitalization rate is low as well. There are 328 people in hospitals in the Commonwealth, with 47 of those in intensive care. And of those 47, 24 are on ventilators. At our own BID Plymouth, as of yesterday, there were 17 confirmed or unconfirmed or potential cases of COVID-19, but nobody in the ICU there. Plymouth County has had 7 new cases since last time we spoke, for a total of 9,242. And in Plymouth County, we've had 947 deaths. Long-term care, I know that was touched upon, but again, 5,862 deaths, or 64% of all deaths, have come from long-term care facilities, with 24,658 confirmed cases since the beginning of this in long-term care. Interesting to note that Bridgewater State University opened up on September 2nd, and they've tested 1,883 students and teachers so far, and the positivity rate is 0.16, so much less than what the state average is as well. So they're doing a really good job there. There's a lot of positive trends. As I just indicated, the positive test rates are going in the right direction. They're under 1%. I think our goal was 5% when this whole thing was starting. So we've been doing well there. Another positive trend is the number of patients in hospitals is really down. The 3-day average is at 6%, which is pretty low. So that's good. The testing capacity, we're testing anywhere between 15 to 30 to 40,000 people a day. So the testing capacity is there, and the contact tracing that Karen talked about is in place as well, and it's important that people actually do answer the phone when that number does pop up to help with that. The governor is speaking as we speak now, and one of the things that is we get calls about, and people text us and email us is the economy. There is the physical health of people, and there's also the physical health of the economy. And one of the things the governor focused on today is talking about the colleges and students going back to K through 12 and the universities and the colleges, and just really let's concentrate over the next 2-3 weeks on see how the reopening of these schools go, and then we'll focus on the business community, particularly restaurants and tourist type industries, because there is as Amy knows, there is a problem down the road with the economy if we can't get restaurants to get to somewhat capacity that they're at now using outdoor, because the outdoor is going to shut down soon. So with the weather, so we got to do something. So that will be looked at in the next couple of weeks. So stay tuned for that. And finally, we all heard that the federal government was going to provide $300 in unemployment. It was $600. Ended July 31st, and then was going to be picked up for $300, the additional that the state gives for unemployment. That actually is starting to be given out this week. So there'll be $300 from the federal government for people that are on unemployment. There's nothing you need to do. If you were getting it before, you'll get it again. And it will go back to August 1st too. So the next few days, people may see some extra money from unemployment for the federal government, because it's going to go back to August 1st. And that is the update for today, Steve.
Thank you, and that is Plymouth Representative Matthew Muratore. We're now going to circle back to our panelists. We have a few questions. We're going to begin with Sarah Cloud from Beth Israel Deaconess. And Sarah, what would be a takeaway from your presentation today? And I would just add that when you talked about parents as it relates to the children, I'm sure we can also learn a lot from our children. And we'll actually be finishing today with 75 Plymouth Public School students who have given us a rendition of a very popular song. Sarah.
Yeah, that rendition was really, really beautiful. And I think we definitely have a lot to learn from students as well, and their resiliency and ability to move on and move forward despite the many challenges and make the best of it.
And Sarah, anything else that you'd like to have us remember today from your presentation?
Just my closing remarks would be directed towards teachers, support staff, and all those who make the school year come together. So speaking from the perspective of working through this pandemic, I just want to share some insights, some things that have worked really well, to really just be patient and kind with yourselves and others, take deep breaths and practice good self-care. And really remember, you are creative and innovative and resourceful. You've met many challenges in your career before this pandemic hits by thinking on your feet. So just want people to encourage people to draw from their experiences to meet the current demands, and be reassured that we have a lot more information about this disease than we did last spring. So it does get easier as you settle into this new routine, even though we may not like it. It will get easier. We'll start to flow better. And I just really want to close by thanking all of those who work in or support a school setting. Real heroes don't wear capes, they teach. Stay well, everyone.
Thank you, Sarah. We're now going to go to Dr. Mark Wilson. Mark, Charlie writes, given your understanding of anatomy and psychology, please specify the anatomy that humans use to breathe, nose, mouth, or chin. And you need to unmute yourself, Mark. If you can just unmute.
Apologies.
Go ahead.
We use our nose and mouth to breathe, of course, but in terms of risk of transmission of the COVID virus, normal breathing is relatively low on the hierarchy of concern. In fact, when we're together with others, or sometimes when we're alone, we're doing much more than breathing. We're talking, we're laughing, we're sneezing, we're coughing, we're singing, and these are the kinds of excited exhalations of air that force aerosol that contains sometimes COVID virus, if we're infected, into the atmosphere, into the surrounding air. And so those are the situations where people need to be very mindful of being distanced from others and ideally wearing a mask, because it's when you're singing, coughing, and laughing that you are at greatest risk of transmitting.
Thank you. And that's Dr. Mark Wilson. He's an epidemiologist in Plymouth. We're next going to go to Karen Keane. Karen, the question for you, considering the high risk for EEE, will there be spraying in Plymouth?
There's no additional spraying scheduled for this time. August 12th was the last spray. Our level has been raised from moderate to high. There are municipalities that are at critical level, but based upon the time of year that it is, the temperatures that we're seeing, there's no additional spraying schedule for this time. But that does not mean that the risk is gone. The risk will not entirely be gone until the first hard freeze. So we'll need to be diligent with wearing long pants, long sleeves, use mosquito repellent, stay out of outside activities if we can from dusk to dawn, and get rid of any freestanding water, especially now with pools being covered. Let's keep an eye on our pool covers.
Thank you. Karen Keane, Director of Plymouth Public Health. Now going to Erik Cioffi, the Assistant Superintendent, Human Resource in Plymouth. Erik, you've had a chance to hear all of our panelists. What would you like us to remember today about Plymouth Public Schools?
We're going to be back very soon. There's a lot of moving parts. You know, I know we're going to be working closely with behavioral health and the Department of Public Health, our community stakeholders, our small businesses. We're all in it together. You know, we might have teachers specifically that got into education, but the students that travel through our buildings are from our community. We are all in it together. So I will be reaching out, getting to know people. We want this transition to be as smooth as possible. We're excited, nervous, we have anxiety, we have the same emotions that are going on at home. And I truly believe once we get the students in the buildings, we can get back to doing what we do. And I look forward, as I said, to make those connections, and we're all in it together. And it's going to be an interesting year. There's a lot of the unknowns. It's going to be fluid. We'll have to make changes, you know, good changes. We got to redo some things. So be patient with us, and just know that all the students that attend the Plymouth Public Schools, that is where our focus will be, is making the best possible decisions for their safety and well-being. So I look forward to getting to know everybody on a personal level, and I do appreciate you inviting me on today. Thank you.
Thank you, Erik Cioffi. He is the Assistant Superintendent for Human Resource in Plymouth Public Schools. Michelle Bratti, you're going to be opening the Center for Active Living next week?
Yes, we are, Steve. Monday, very limited, but very excited to see everybody. Absolutely. Just want to end by letting people know, again, that buzzword, we are not going to stop saying it. Social isolation is real, and it is dangerous on multiple levels. There was a recent study done through UMass that equated sustained senior isolation as having the same negative health effects as smoking and obesity, resulting in declining health and higher mortality rates. As a community, we do have a responsibility to continuously find uplifting and creative ways to combat senior social isolation. We need to do this in partnership with our seniors to empower our elders to utilize their minds and engage their positive energy to problem solve solutions. They truly do know more than us about coping and surviving during difficult times. We simply have to ask the questions to be on the receiving end of such valuable and timely wisdom. Seeing their faces next week and honoring them next week as well certainly paves a way for a little bit of cutting through that social isolation. Thanks for having me.
Thank you, Michelle Bratti, Director of Elder Affairs. We're going to go back to Amy Naples, Plymouth Area Chamber of Commerce. Amy, what should we remember today?
So first, I just want to welcome Erik. I look forward to working with you, and if I can assist you with anything, please don't hesitate to reach out, because we are your friendly Chamber of Commerce, and our doors are always open. Always such a pleasure to see all of the fellow panelists. Amazing information as always. I truly enjoy being a part of the program. I also just want to extend a huge thank you to Karen Keane, who has been working with our local restaurants and helping them with endless questions, ensuring the safety of our community, just getting them up and running. She has just been truly amazing through this entire process and helped the local businesses overcome a lot of the challenges. So I just want to say thank you, Karen. She's always willing to lend a hand, hop on a Zoom. So I'm very appreciative of all of our hard work and the hard work of the Board of Health as well. We are super excited to be part of the Cal Senior Appreciation Day and honored to show our appreciation and thank you to the seniors in our community. I think seniors are much like our businesses, strong, resilient, and should be recognized for their accomplishments, the dedication to their community. They are certainly one of a kind, so it's just an honor to be a part of it. So if there is a business that would like to be involved, please feel free to reach out to my office at 508-830-1620. And lastly, just want to thank you all for supporting our local businesses.
Thank you, Amy Naples, Executive Director, Plymouth Area Chamber of Commerce. And we're going to circle back now to our Plymouth State Representative, Matthew Muratore. Matt, anything updated from the governor?
Nothing more from the governor, but I just want to thank you again, Steve, for bringing us all together on this, doing this on a weekly basis. I think it's important for the community. I'm so thrilled to hear that the Cal is going to be opening up and starting to see seniors come back. It's just so great to see, and along with the schools as well. And I think as Sarah knows, social isolation is an issue with seniors and children. I have, one of my best friends is struggling with it, with this isolation and not being able to get together with people. So getting back to some new normal is going to be great I think for everyone to see, but we can't forget, where we were and what we need to do and what the game plan still is. Looking at some of these stats, we need to put it in perspective. 27% of those, the entire population of the Commonwealth have been tested. That's a good number. 1% of the population has died from this. Not such a good number, but if you look at it in perspective, it's 1%. So we really need to continue to do what we've been asked to do, and social distance and wash your hands and wear the mask. Wearing the mask is probably the one of the most important things that you can do, and why we've done so well here in the Commonwealth. So let's all keep up the great work. Let's continue working together. And, as Sarah said, let's continue to be kind and respectful to one another.
Thank you, Plymouth State Representative Matthew Muratore, and to all our participants, including Sarah Cloud, Dr. Mark Wilson, Karen Keane, Erik Cioffi, Michelle Bratti, Amy Naples, and as we return back to close, to the chair of the Plymouth Select Board, Ken Tavares. Ken, what do you have for us?
Thank you, Steve. First, I'd like to welcome Erik on behalf of the Board of Selectmen to Plymouth. We're very pleased to have you, and know that you realize you're joining a phenomenal team that has really put Plymouth on the map educationally. So welcome, Erik, and we're happy to have you. Also, since all of this has started in March, I think I've joined a number of other citizens that have constantly watched people on the state, federal, and local level in regards to medical advice. And I can tell you that our household, later in the afternoon today, we've made the arrangements to get the vaccine shot that has been recommended. I think that there's a great deal of good advice that's coming from the medical profession, especially on this program. So we're taking that advice and following it. And the last thing I'd like to talk about just for a minute is Plymouth is blessed to have a large number of women leaders that have made a difference in this community. But in the last few months, two women stand out in my mind because of their dedication, perseverance, and actually the way they approach their job. Karen Keane and Pearl Sears have done an outstanding job both in running the Board of Health office and also the town clerk's office. Pearl took over from Larry Pisa when he retired with great enthusiasm. And both of these women I've had the opportunity since we stopped having the program on in June to talk to on numerous times. And it doesn't matter what hour of the day it is or what the subject matter is. They have done a great job in leading this community. So I want to thank both Karen and Pearl, as well as all of the other outstanding women leaders that are part of this great town of ours. So thank you. And as the other speakers have said, we need to continue to wear those masks, keep our distance, and wash our hands. The advice from the medical profession is solid. We just need to follow it and do our part. Thank you, Steve.
Thank you, Kenneth Tavares, Chair of the Plymouth Select Board. And again, thank you to PAC TV. We'll be coming back to you every Wednesday at 12 noon throughout this fall. And as we said earlier, we're going to close with some students who led a very moving rendition of We Won't Give Up from the Plymouth Public Schools. This was presented to teachers at the start of last week, and we'd like to leave you now. Please enjoy this. Good day.
When I look into your eyes, it's like watching the night sky or a beautiful sunrise. There's so much they hold. And just like them old stars, I see that you've come so far to be right where you are. How old is your soul? Well, I won't give up on us, even if the skies get rough. I'm giving you all my love, still looking up. And when you're needing your space, turn through some navigating. I'll be here patiently waiting to see what you find. 'Cause even the stars, they burn. Some even fall to the earth. We got a lot to learn. God knows we're worth it. No, I won't give up. I don't wanna be someone who walks away so easily. I'm here to stay and make the difference that I can.